Type 1 diabetes mellitus is a disease that affects the body's ability to control blood sugar levels. People with type 1 diabetes cannot produce insulin, a hormone that reduces sugar levels and prevents them from rising too high. This is usually due to a fault in the immune system, which attacks the body's own cells, specifically ones called the islets of Langerhans in the pancreas. Therefore, people with type 1 diabetes need to inject insulin throughout the day to make sure their blood sugar levels aren't too high or too low. In Manchester, we offer 2 potential treatments for severe type 1 diabetes, both of which give people the islet cells they require to make their own insulin. We can do this with a pancreas transplant. This involves a major operation which adds an extra pancreas from a donor into the patient's abdomen, which then produces insulin. The other type of transplant we do is an islet transplant, which takes the hormone-producing cells out of a donor's pancreas and adds them to the liver via a drip. This is a much less risky procedure than a pancreas transplant, with fewer complications. However, islet transplants, as yet, do not work as well or for as long as pancreas transplants. Therefore, patients may need to continue to inject small amounts of insulin following the procedure. In Manchester, we're doing research to make both of these transplants work better and for longer for more people. We're looking at ways of reducing the complications of pancreas transplants and improving selection of patients undergoing the procedure. We're also looking more closely at islets after they've been placed into the liver to work out why they can fail over time, with the hope of developing new ways to make islet transplantation better. My name is Dan, and I'm a trainee surgeon and researcher at the University of Manchester.